Hello, I'm Dr. Brandon Blue, an assistant member of the Malignant Hematology Department at Moffitt Cancer Center. Multiple myeloma unfortunately disproportionately affects African American and Hispanic patients. That's my community, and that's why I'm personally really interested in trying to make sure that we improve the disparities for all patients with multiple myeloma. We're here to discuss disparities across multiple myeloma patient journey with Gary, a multiple myeloma patient and survivor.
Hi, I'm Gary Lambert. I was diagnosed with stage 3 multiple myeloma in 2014, and I've been living with myeloma for 10 years.
Now, before we get into it, I want to say that I look forward to answering your questions on disparities in caring for multiple myeloma and hearing your perspective as a multiple myeloma patient and survivor.
How do you work with your patients of color to choose the right treatments when there's so many options today?
As clinicians, we need to make sure that patients receive the most appropriate therapies while making sure that the patient is a partner in the decision-making process. Unfortunately, in a recent survey, fewer Black and Latinx patients reported being involved in the treatment decision-making than white patients did. Also, multiple studies have shown that Black patients report lower levels of trust in their healthcare teams than white patients do. I believe that trust is the first step in the shared decision-making process, so I build relationships with all my patients by communicating in a respectful and culturally sensitive way, listening to and validating the concerns of my patients, working with their perspectives and insights into the decision-making process. Plus, several patient advocacy groups such as the International Myeloma Foundation, the Multiple Myeloma Research Foundation, and the Health Tree Foundation provide resources on their websites for patient education and navigation.
Building a collaborative relationship with my HEMOC team really factored into the treatment I chose. I felt comfortable discussing my goals and having honest discussions about risk versus reward. Understanding how vital this patient-clinician relationship is, how do you think implicit bias affects the treatment of patients of color and how that can be addressed?
Well, studies have found that implicit racial biases from clinicians can lead them to believe that Black patients will be less likely to follow their treatment plan. This belief, together with the fact that the cost of myeloma therapies has had the biggest impact on patients of color, who are more likely to be socioeconomically disadvantaged, may result in unequal access to care. Additionally, studies have shown that Black patients are less likely than white patients to receive actually standard of care treatment, like triplet therapies or stem cell transplant. Other research has shown that Hispanic patients are also less likely to undergo stem cell transplant than non-Hispanic white patients. To help address these issues, I try to ensure that my Black and Hispanic patients are being prescribed the most effective anti-myeloma therapies according to evidence-based guidelines, and be vigilant about any conscious and unconscious biases. So I'm not making any assumptions about any of my patients and their openness to treatment.
We have just talked about your approach to working with patients to choose from different approved treatment options. Let's move beyond that to clinical trials that test potential new medicines. I haven't participated in clinical trials, but I know that there are many others that have. How do you work with patients of color to decide if a clinical trial is the right next step for them?
Black and Hispanic Americans are highly underrepresented in multiple myeloma clinical trials, but many patients are open to participating in a trial when the option is presented by their healthcare team. So I try to stay up to date on available clinical trial opportunities for all of my patients and keep in mind whether any of them might be eligible for a referral to a clinical trial. Lastly, there are several useful resources to help patients to explore clinical trials in myeloma and may help clinicians to drive conversations with patients on potential clinical trial participation.
I've considered clinical trials during the 10 years I've lived with multiple myeloma, but the timing was never right. I've had lots of conversations with clinicians and participated in various working groups about trials and potential new treatments for myeloma, so I understand how important these opportunities are. especially for patients who have exhausted more traditional options or are healthy enough to try something more aggressive. Dr. Blue, thank you for answering a few of my questions and sharing your thoughts on addressing disparities in myeloma therapy.
It was a pleasure chatting with you, and I look forward to continuing this conversation.